Today topic is hospital pharmacy and its organization. Hospital pharmacy is the healthcare service which comprises the art, practical and profession of the choosing, preparing, sorting, compounding and dispensing the medicines and medical devices by advising the healthcare professionals and patients on their safe, effective, and efficient use. Hospital pharmacy is specialized field of pharmacy which forms an integrated part of the patient healthcare in the health facility. The hospital pharmacy is the profession that strives to continuously maintain and improve the medication management and pharmaceutical care of the patients to the highest standards in a hospital setting. Functions of the pharmacy. The hospital pharmacy provides specifications for the purchase of drugs, chemicals, biologicals, etc. Here, the proper storing of drug can be maintained and manufacture distribution of the medicaments such as transfusion fluids, parenterals, products, tablets, capsules, ointments, stock mixtures. These are dispensed and sterilized parenteral preparations which are manufactured in the hospital. And also hospital pharmacy performs the filling and labeling of the drug containers from the medicines that are to be administered. And establishment maintenance of the drug information center, providing cooperation in the teaching and research programs which are performed by the hospital pharmacy. Whereas come to the hospital pharmacy organization structure, the pharmacy manager identifies the design that mostly close to the pharmacy's need. This design is molded to match with the unique requirements of the pharmacy and the hospital administration. The size and nature of the pharmacy department management depend upon the number of personnel and the size and nature of the pharmacy department management will depend upon the number of personnel in the department and the scope of service. Small pharmacies which are tend to have much simpler to understand the no problems which arise in the healthcare centers. Large pharmacies with the assistants, chief pharmacist, supervisors, and professional personnel have the complex organizational structure. Therefore, the authority must be delegated by the chief pharmacist. Here, the structure of the hospital pharmacy is given. You will notice here. These two are the hospital pharmacy types. I will show you clearly. This is the storage areas and here a desk is there and refting super here the working area. These are the materials which are placed and then this is another type of the hospital pharmacy structure. These are the outlet of the pharmacy and the staff required in the hospital pharmacy depends upon the strength of the patients who are available in the hospital. Up to 50 beds are placed in a hospital, then the number of pharmacists is 3 and 100 beds hospital require 5 number of the pharmacist and 200 beds contains 8 pharmacists, 300 beds contain 10 pharmacists, 500 beds needs 15 pharmacists. Here the table is given. You can observe the number of pharmacists and bed strength. According to the bed strength, the hospital pharmacy will be changed. And role and responsibility of the dispensing pharmacies hospital pharmacy is already known in previous classes. So next topic is adverse drug reactions and drug interactions. Here adverse drug reactions are the unwanted effects of the drugs which result at the therapeutic or diagnostic dose level. These adverse drug reactions results to call the decrease dose or withdraw the drug from the future use. These adverse drug reactions can be defined as the following. Here, the adverse drug reactions is damage stage which can be result from the medical involvement related to the drug. As per WHO, adverse drug reactions are defined as noxious and unwanted effects of the drugs that occurs at the dose which given to the human being for prophylaxis or diagnosis treatment. Another definition is toxicity. Here, the toxicity indicates a direct effect of the drug at high doses of the drug which damaging the cells of the human body. Some examples of the toxicity reactions are given. They are overdose of the paracetamol produce liver damage, and likewise gentamicin produced cranial nerve damage. Overdose of the gentamicin ethambutol, it causes oculotoxicity. And if you have taken any drug in overdoses overly, means it shows some adverse effects. It leads to the death also in some cases. Some reasons of the adverse drug reactions. While increasing the availability of the potent drug, the availability of the drugs without prescription, it also causes the adverse drug reactions. So compulsory the patient who needs doctor consultancy and also the prescription must have to sold the drugs, to buy the drugs. And polypharmacy, that is irrational use of the drugs together needlessly. Use of self-medication, it also causes the adverse drug reactions. The number of adverse drug reactions occurring in the minor, but around 70% of the reported adverse drug reactions are include rashes, itching, headache, drowsiness, convulsions, insomnia, double vision, extra sensitivity, and ringing in ears and GI distribution. These can be seen in the adverse drug reactions. Here, the adverse drug reactions can be classified into some types. They are predictable type 1. This is also called as the immunologic reactions.